but it's something I feel that we need to cover, particularly over on the Clock app. I'm finding that there's a lot of health professionals, so doctors, paramedics, nurses, mental health nurses, and counsellors who are younger talking about their clients. They may think that they can't identify them, but guys, this is very nation dependent. So in Australia, we have APRA. So I'm actually currently on their website, if my technology works, because those of you who saw the drama last night about me trying to upload will know what I'm talking about. Going to go with the support worker, see if my computer needs a service as well. So APRA is the Australian Registration Board. This is social media, how to meet your obligations under the national law. So when using social media, and I am reading off their site, when using social media, you can meet your obligations by complying with confidentiality and privacy obligations, complying with your professional obligations as defined by your board's code of conduct, maintaining professional boundaries, communicating professional and respectfully with or about patients, colleagues, and employers, and not presenting information that is false, misleading, deceptive, including advertising claims that are only supported by acceptable evidence. So that is scientific evidence that has been published in a journal and peer reviewed. Then what are the common pitfalls when using social media? They've got some others. I will try to put them up there. Try being the operative word. When using social media, just as with all aspects of professional conduct and behaviour, you need to be aware of your professional obligations and other relevant legislation, such as privacy legislation. Where relevant, national boards may consider social media use in your private life. So there we go, in your private life. Even where there is no identifiable link to you as a registered health practitioner, if it raises concerns about your fitness to hold a registration. You may think that you are engaging in social media in a private capacity because you do not state you're a registered practitioner. It is relatively easier for anyone to check your status through the register or make connections using available pieces of information. Take care when using apps and sites to ensure that you do not inadvertently post or communicate publicly while thinking you're communicating privately. Make sure you know and understand the relevant security and privacy settings. And remember, even if you're thinking you're doing it privately, you don't know who's screenshotted that or anything like that. I've had a situation where I've lost a job because of what I said in the private group. And this is where I felt the need to speak up about this. The following are examples of activity on social media that could trigger someone to make a notification about a registered practitioner. These examples do not imply or assume that these matters would reach the threshold for the board to take regulatory action. Patient confidentiality. So when sharing information, including comments or photos that you do not inadvertently disclose patient information, check what is in the background of a photo before sharing it and make sure that information that you share does not unintentionally disclose personal information about individuals, because someone might use available information to work out who you're talking about. I have had this happen. Although individual pieces of information may not breach confidentiality, the sum of the published information online could be enough to identify a patient or someone close to them. And guys, you don't know what's going on in that person's personal life unless you're a mental health professional or an RN that's been working with them a long time. And even then, there might be reasons that they choose not to share with you as well. So this is a couple of examples, and I am now just skim reading for the sake of time. A mother posts an update about her daughter's admission to hospital following a car accident. The mother tags her friend, a health practitioner who happened to be on the ward the night the daughter was admitted. The tag is complimentary about the care received at the hospital. The nurse responds publicly to the comment, thinking it was a private message, and inadvertently provides information about the daughter's recovery and the status of the other passengers in the car. Parents of the other passengers make a formal complaint about the privacy breach. And then example 2 is a radiographer proudly posed a selfie on his first day of the job in front of an X-ray he'd taken earlier, showing an open compound fracture. The radiographer thought he wasn't compromising patient privacy, but was unaware that the name of the patient could be read if the image was enlarged. So, guys, this is where particularly professionalism and TikTok and YouTube, when you're talking about situations, regardless of how long ago it was, you need to have a client's consent. And guys, I'm seeing a lot of people who are doing the TikTok trends of I'm a nursing practitioner or I'm a support worker and this is what's happened. And you think that they're just social awareness, things like that. But guys, it's actually, from my perspective as a person with a disability, if I and my behaviours are concerned were used in that without consent, I would be making a complaint as well. So this is where you have to be very aware of people like Steve-O, EMT, board teachers, so Mrs. Rachel, have actually retired from their profession and are making a living full-time on social media. There has been with Steve-O, I know, a few misinformation where they've had to take it down as well. But what they're doing is creating caricatures of multiple people and multiple situations. And so, guys, this also comes into the too posh to wash debate and student nurses. Guys, and it also is crossing over to support workers. I know that there is no formal registration body for support workers, but I do feel that NDIS registration is coming very quickly because far too many people are seeing that people are being screwed over by agencies, being screwed over by private support workers, and they're seeing the little things like not asking can they take biscuits and seeing what more they can get away with. That is both on the client side and the support worker side. But you guys need to remember that you're looking after people who can't defend themselves, whether that be a support worker, whether that be a caregiver. I know in some other videos, I've seen caregivers referred to as PAs, so personal assistants, so helping with personal hygiene, activities of daily living. And what people forget about learning to do activities of daily living and complaining publicly about learning to do activities of daily living, you are going to learn so much about doing those things. So how do you do it? How do you communicate with the patient? Checking skin integrity, checking if they're ambulatory, can they walk from their bed to the bathroom, stand in a shower that is going to get wet and back. And what is their level of hygiene? What for them is an acceptable level of hygiene? So this is something that it's been bugging me for a while as well, is that people don't seem to take privacy of a person with a disability or a patient seriously anymore. Guys, this is where ethics become really important as well. So those ethics are a guideline. I know that there are people in very high positions of power who've spoken out against very unethical treatment and people being radicalized. So think about Dr. Jordan Peterson and his defense of the compelled speech laws, Bill C-16 over in Canada. Think about nurses speaking up about doing your research with the COVID vaccine. I can understand being vaccine hesitant and not wanting to get the jab and searching the evidence. But then on the flip side, when you see people doing skits about what happened on their shift last night, that person could easily be on their phone and identifying themselves. So best idea is, and this is something that I do as well, every time I hit record, I make sure that there's no one else in the house, or if it's on the weekend, they can't be identified. I get permission every time, whether that be recording YouTube, TikTok, podcast, shorts, or writing a blog post every time. I am not perfect. I'll admit that there was a blog post I had to take down. But this is the thing. People are in a social media age. It only takes, in a regional town, 5 people to get back to you. In a city, 7. So, guys, you need to be very aware when you're making sarcastic comments about a client or even in real life, a party. I've heard nurse practitioners saying about people with behaviours of concern and give them TLC, not meaning tender loving care, meaning temazepam, lorazepam, and Klonopin. These are all considered chemical restraints, and if you're put them on them in hospital, you're likely to continue onto them, and that can affect your quality of life. And you're thinking, oh, that's not going to affect that person. I have had a medication incident. Check my life update and why I don't agree with self-diagnosed videos as well. You'll understand why I'm very much against diagnosis and for checking everything for yourself, being able to have scientific literacy. And this also comes back with privacy. Scientific literature, they randomize it to prevent privacy breaches. And you're probably thinking, hang on, but you talk about disability. But this is the thing. Support workers don't have a professional board. They also, I'm not sure, correct me in the comments, if they even have a union. And so that's the thing. People come into support thinking it's easy, it's all unicorns and rainbows, it's all taking out people out coffee and cake and visiting people. No, it is hard work. It's teaching life skills, it's helping with activities of daily living. It's literally showers, shower, shaves at times. It's keeping houses clean. It's resolving jealousy. This is the thing, that privacy in support is not taken seriously. And there's 2 aspects of that as well. So there's where privacy is constantly breached through people gossiping, not being supported by the office, or not having the consequences for gossip. And then there's using privacy as an excuse. So not checking in on higher functioning clients, leaving them to their own devices because other clients in the house are going to get jealous. Guys, we are paying for the care, whether that be through tax or privately or through state government funding. We are paying for this care. And people I know are going to say that this is an entitlement issue. I have had to work through the entitlement to go, hang on, I've worked for the past 15 to 20 years. When the YouTube is monetized, I will be paying taxes again. I have a care disability, so therefore, having care releases my family and friends from having to step in where a support worker can fill in the gap. And so this is where I am very intentional about saying and de-identifying my housemates. I've never mentioned my housing agency. My community access agency is quite happy for people, them to be mentioned on camera, but I always send them the rough draft, what I'm doing, and asking my support workers if they want to be filmed as well. But guys, think about what you're saying and what you're doing before you hit record. So in Australia, there was actually several court cases around privacy and the right to privacy. And we now have legislation that's up for debate in the next couple of months around internet privacy, literally called the right to be forgotten. And so that is if someone is posting to YouTube, a blog, Rumble, TikTok, 4chan, Reddit, they don't care what it is. If it's identifiable, you can send someone a takedown notice and damages for harm. But the main thing is a takedown notice as well, because you don't want that young, stupid incident to follow you around for the rest of your life as well. So, guys, I know this has been a bit of a heavier one, but guys, this is why I bang on about privacy. And there's also only 3 reasons as a medical practitioner that you guys, by law, are allowed to breach someone's privacy. If they're at risk of harming themselves, if they're at risk of harming others, or they are at risk of abuse, neglect, or exploitation, if they are a person with a disability. So they are the 3 legal reasons. So this is where you need to be very careful and know who is trustworthy. So this is why I always say having a qualified mental health professional or a mentor that you can talk to about situations that have happened, how you could have prevented them, what documentation needs to happen. And remembering when doing documentation, either involving the client and the patient in documentation, in what's going in the notes about them, or doing it completely privately. It's got to be one or the other. And that's the thing that people don't understand. The right to privacy doesn't supersede the right to care. And so I would rather someone breach my privacy if they haven't heard me moving around, if they don't know if I've eaten, because as a support worker, that is their job. And if someone's going to be jealous, I've done a de-escalation video. Not sure if it's gone live yet at time of recording, but de-escalation and being able to manage personalities is such an underutilized skill in disability. And so de-escalation is basically using tools and techniques to keep yourself calm so a situation doesn't escalate into conflict, into behaviours of concern, or using a person's positive behaviour support plan to be able to work with that person to redirect those behaviours. And this is where documentation becomes important. So documentation is a whole other topic. Deb and I have talked about it, but I'm going to do a podcast on it as well. So guys, thank you for getting to the end. If you can like, share, subscribe, comment, particularly subscribing, guys, 80% of you guys who are returning aren't subscribed. So guys, if 70% of you subscribe, I'd be monetized. And we can talk about a lot more wider topics as well. Because guys, I've made a promise to myself, I'm going to start talking about the more difficult aspects of disability. And so that's things that people aren't covering. So that's the right to privacy, the right to care. That diagnosis doesn't actually equal acceptance into a care program. The difference between a health condition and a disability, toxic positivity. I know others have talked about these guys, but the thing is, the NDIS in Australia is at risk, and unless we have people speaking out about it, there are some things that I'm seeing disability advocates are saying that we need to get rid of, that they don't agree with, but do they know the full story? That's the thing with privacy. Do we know the full story? Do we even need to know the story? So when you're a medical professional or a carer for someone, that's where getting their consent is so important. Guys, that's my alarm for a support worker coming in about half an hour. So I'll see you guys in the next video.